Okay, so here is the address that I have taken from here. So this is how you will write the address. And in the I have written Mrs. Ann Howard, comma, 36 years old. So there are many ways in which you can write this. You can just write, okay, Mrs. Ann Howard, comma, aged, semicolon, and then 47 years, or again aged and colon, and then 47 years of age, or a aged colon and 76. So there are many ways in which you can write this letter. Sorry, write the age. So now we will start, and the information is, okay, write a referral letter. So it's a referral letter. We are going to write that. Now you will be given 5 minutes to just to read this letter. So in that 5 minutes, it's very important that you just read the case notes, and in your mind, try to organize the card. Okay, that how you're going to take, or how you will organize it, and how you will take it. So it's a normal referral letter. So the pattern of the referral letter will be introduction, then the past history, then the initial visits, and then in the end, today's visit. Okay, so if we just go with the, if you just start from here. Okay, now we just select the relevant information. So, okay, fine, ovarian cystectomy and appendectomy. Okay, we are writing to whom? Case notes. Okay, he's a surgeon. Okay, he's a surgeon, and we are writing this letter to a surgeon. So yes, this ovarian and this is relevant information that we have to give. Then I don't think so that this will be some kind of relevant information for this doctor, because he's a surgeon, he is not a gynecologist. So okay, I will just keep this risk. Okay, fine. Left lower abdominal pain, then again vaginal bleeding, hospital emergency, and spontaneous abortion. Okay, fine. And can you see that there is a question mark uh, beside this spontaneous abortion, which is we are suspecting. Okay, it's not confirmed. If it was confirmed, then there will be no question mark. Okay, fine. Then initially she was visited on this 20th 7, then 21st 7, and then 22nd. And this card has only 3 visits. Okay, and the initial visit was what? Lower abdominal pain, which was relieved by Valium. Pain persist. Okay, this all everything is happening on the 20th. Okay, so, and yes, one more thing. See, I have written here the date of the last visit. That is the today's visit. Okay, in the exam it will be written over here that assume today's date is that. Okay, and if it's not written, then you will write the date of the recent or the very recent visit. You will just write the date here, because you will assume that's the date of the today's when you're just going to write the letter. Okay, and pain persists, sharp, constant, worse, sitting up, walking, heading. Okay, no vomiting, nausea. Okay, fine. Okay, fine. This, not distress, pulse, very tender, lower abdomen. Okay, fine. This is something very important, and this I have to mention. Okay, and then on the second, okay, pain persists, no bowel motions, motion for 3 days when passed, heart, stool, coated with bright red blood. Okay, this she there was no bowel motion for 3 days. Okay, and when she passed the stool after 3 days, it was it was coated in red blood. And today it was, pain was there, and it was it was worse, it was getting worse after eating food. Okay, and then moderately distressed, abdomen tense, hemoglobin was this. Okay, quiet bowel sounds, no action of lots. Okay, fine. Assessment, early bowel obstruction and diverticulitis or carcinoma, and we are going to refer to this doctor. Okay, now we are suspecting that he might be having diverticulitis or carcinoma. So now we will just just keeping this one thing in mind, we will write the introduction. So what we will write is, we'll start from here. Okay. Uh, I am sorry. I am writing. Yeah, I'm right. Yes, I'm writing to refer Mrs. Howard. Then again, comma. You can also write, okay, who has sign and symptoms, or whose sign and symptoms are suggestive of. You can also write that, or you can just write, okay, who has demonstrated signs Yep, who has demonstrated features indicative of. Okay, you can write that also. Who has demonstrated features indicative of what? Early bowel obstruction. Early bowel obstruction. Okay, then comma, and there are two possibilities. So possibly due to what? Diverticulitis or carcinoma or cancer. Okay, you can just use synonyms also to write your letter. It will give you high marks. Early bowel obstruction, possibly due to diver or cancer. Okay, now full stop. Now this is a normal referral letter, so I will not use the word urgent or something. I will just go with the flow. Your valuable assessment, your or you can say, okay, your further assessment and management would be highly appreciated or will be greatly appreciated. Okay, your valuable assessment and management, because we are just sending her for both, because we are not confirmed about the cause which is causing this, so we are just going to send the patient for both assessment and management would be greatly appreciated. Now you can see that I have simply wrote the introduction in very easy language. There is no twisting it, nothing. And just by reading this introduction, the examiner or the doctor might know that what I'm trying to say, or what he you know will expect in the letter. That okay, fine, the patient is having what? Early bowel obstruction, and maybe it's because of what? Diverticulitis or cancer. And what I have to do, I have to assess this patient, and then I have to manage the patient. So this is the introduction. Okay, now coming forward, as I said that this is a referral letter, so we will write her personal history. So what is her personal history of ovarian cystectomy and appendectomy, which is relevant for a surgeon to know it. So we just write that, okay, Mrs. Howard has a history of what? Ovarian cystectomy and and. It's very important, although it's not written here and, but you have to include this. With every vowel, you have to write this. And it just marks in grammar also. They will check for this also. And make sure that you're writing the spellings, when you're doing listening, or you are doing this writing, make sure that your spelling is absolutely correct, because you are copying it from somewhere. As well as what? Lower abdominal pain. Okay, lower abdominal pain. And what? Spontaneous, yeah, and a spontaneous, suspected spontaneous abortion. Okay, because she is having the history of ovarian cystectomy and appendectomy also. This is not relevant. Yes, left lower abdominal pain is relevant, because we are writing to a surgeon. It can be anything. It might be a mass, appendix, or anything. It can be over there, or ectopic pregnancy, where and then this something spontaneous. So we will just write it, as well as what? Abdominal pain and a suspected spontaneous abortion. Full stop. Now again, with minimum use of extra words, I have just wrote the past history. Okay, Mrs. I have just written it in a simple, clear language. Like the lady who posted in the group that, okay, fine, the patient is having, because this she was having a history. No, you don't have to. In terms of her surgical history, there is no need to write all this thing. If you are writing, or if there is only one thing, or if there is only one thing, for example, if there is was only ovarian cystectomy, so instead of writing one thing, okay, fine, you will just say, okay, please note she has a positive history of what spontaneous abortion. Okay, you will just write one thing in paragraph, the initial paragraph, when you will be writing the initial visit. So it is very this, okay, has a history of what this as well as what this and this. Okay, now I will start with the first visit. Now her first visit was, she visited on this date, and she was having this lower abdominal pain. Okay, and which was worse on movements. And she, means, she was having this pain a day before she visited the doctor, or she visited me, and today also she's having this pain. Okay, so these are two different things. She came yesterday also to report it yesterday, said and this, and today again she's having this. So we are going to organize it in a proper sentences, and then, okay, fine, she was not distressed, and this, and I just arranged this examination or the investigations for her. And what I found was lower quarter abdomen. There was no weight loss, no change of bowel habits, and nothing. Okay, so we just start. Now what we can say is that we can write, okay, initially on, yeah, we can also say, okay, Mrs. Howard visited me on this. But as I always say, try to say words. So we can just, okay, write it, okay, on 20th January 2007, Mrs. Howard. Or you can just say, write it over here also, initially on this. But as I have not mentioned this initially there, I can mention it here. Or if you want, you can skip that also. On Mrs. Presented with, or you can just write initially also. But if you want, you can skip it from here and write it in the beginning, or you can just skip altogether. But if you just skip it, initially means that this was her very first visit. Okay, and before that, because see, we are writing two, we will be writing two complaints. One happened yesterday and today when she presented. Okay, initially this presented with what? With the complaint of, it's what? Sharp, persistent, and constant pain. Can you see that I'm writing today's? She presented with what? Sharp, persists, like it was persistent, sharp, persistent, constant pain. Present with the complaint of sharp, persistent, and constant left lower abdominal pain. Okay, now when I have written this, then this is the pain, and which verses with what? Sitting up, walking up. So I will just make it a one sentence. I will just write it over here, comma, which has, no, which was, because we are writing in past. Okay, which was worse on movement. Instead of writing, okay, that, okay, fine, sitting, waking, bending, it's a movement. So I have again, just saved the words. Instead of writing all these three, that, okay, fine, which was worse on sitting, walking, and bending, you can just write, okay, which was worse on movement. Okay, it's the same. She reported. Then now When I have done with today's, okay, this was today, then I will just mention the yesterday one. She reported a similar episode, a similar episode yesterday, which responded to William. Now, William is a market name, so I will just write it in capital. Okay. Now you will see that, okay, fine. I have just when I wrote initially, I just wrote the today's what she came with. Then I said, okay, fine. Then she reported a similar episode yesterday. Okay, which responded to this. Now what you can say, okay, fine. Okay, then you can use a connector here if you want. Okay, now we are just writing something very contrasting. Now we have wrote everything that is positive. Now we are going to write negative findings. These are the negative findings. No, 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 no. So you can also write here, however. Okay, you can use this, however. She denied, uh however, she denied having. Now you can just change the sentence also. However, there was no, या फिर she denied, या फिर however, she reported no, this is also you can write. Okay, she denied having nausea, vomiting, weight loss, and bowel symptoms. So this is the easiest way that she denied having this. Or if you want to mention this, although these are negative findings, but because of if you're writing to a surgeon, it is relevant for him. For the surgeon, it is relevant because these kind of symptoms can be presented with if there is any obstruction, or if there is any appendix, or if there is any mass which is causing any symptoms, this weight changes, everything. This is important. But if you are writing to a general any other occupation, like for example, if you write to anyone else, then you can skip this because these are the negative findings. But if you are going to write the negative findings, just write in one sentence. Do not write in 2 to 3 sentences, because I have seen many letters which you just you elaborate the symptoms, the presenting complaint so much that in one line you are just writing one symptom, one complaint, and one something. So this. Now what now if coming to the objective, that is the examination which we have done. So now we will just say, okay, you can say, okay, or you can just
Dr.
start
Hina,
the. Yes.
can I ask you something? Yeah, so
Yes.
this is, you are writing about 22nd, right? It is today. So
No, this is not
like,
22nd, it's 20th.
yeah, because we have started from today's presentation, that is 22nd. No?
नहीं
Uh,
नहीं 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 20th में भी ना उसने 2 इवेंट्स हुए हैं. शी
yeah, but she has
रिपोर्टेड
presented
yesterday
today.
एंड देन
Yeah.
टुडे. तो मैं 20th की बात कर रही हूँ, जो कि 20th गुजर चुका है. टुडे का दिन है 22nd. सो इट्स
Okay.
पास्ट.
Okay. So we have started from her 20, like
Initial
from her
visit,
the
that is
beginning.
20th.
Yeah. Uh,
Yes. Okay. So we have started from that. Okay. Now you can just start. Okay, fine. On examination, or you can say her examination. You can choose anyone you like. Okay. Her examination revealed. What her examination revealed? It was tender and mass. Okay. It was her examination revealed what? Now instead of very tender, I will you write the word synonym. It was severe tenderness. Okay, where it was in the left lower quadrant, you can write, or the left lower abdomen also you can write, in the left lower abdomen. And what? And a pal and a palpable mass. full stop. Okay, now I have written everything. Now what I have done. So as a result, okay, a pregnancy test, comma, CB, acronyms you have to write in capital, CBC, and again here you'll write and before ESR, were ordered. Okay, so I have written this. Now my 20th date, it has finished. Now I have covered everything which was in 20th. I have written, that, okay, she presented with this. She was having this persistent pain, okay, and which was in left lower quadrant, abdomen, and which was on movement. She reported similar episode yesterday because she had the similar, for which she took what? Again, for which there is no need you write for, which responded to, you can write it, okay, or you can also write for which, which responded is because it was relieved. Yeah, which was relieved by taking William, yeah, which was relieved by William, also you can write, but again, it's better to use synonyms to get more marks. It will show that you have a strong grip on the language of English. Okay, now this, okay, however, she denied because she was not having these symptoms, and her examination not distressed, that was not relevant. Blood pressure and this was not relevant. So, and it's in the past, so that is why I'm not mentioning that. It was, I would just mention the relevant findings, which was this: it was painful, and these were the tests that I ordered. Now on 21st and the 22nd. Okay, now there was only one date. Okay, I can also write on her subsequent visit, or I can also write on her review visit. Okay, I can write anything over here. Now whatever you like, you can just write. I will just give on the review visit just to get extra points. It's something different because on her subsequent visit, yeah, or on this date 21st, this is, everyone writes that. So if you just want to get some extra marks, then just think out of the box, write something fancy, and get some marks. Okay, on the review visit, again, Mrs. Howard, what she reported. Now again, when I have told, in the first, I just wrote presented. So instead of repeating that again, presented, that, okay, fine, on the review visit, Mrs. Howard presented with this. No, I will just change the wordings. Okay, the pain was, again, the pain was persistent but less. The pain, so there was some kind of improvement in the pain, and there was no bowel motion. Okay, fine. Reported what? Pain was less. So the pain was somehow relieved. Okay, reported what? Relieving. Pain. Reported what? Relieving of her pain. Okay, to some extent. Now, can you see how I have, paraphrased it? Pain persists, but less. Pain is still there, but it's less. Okay, reported relieving of her pain to some extent. Okay, to some extent. Okay, and then I will just know about. Now, this is again something very contrasting. It's a good news that, okay, fine, her pain was relieved, but again, this is something very bad and it's contrasting. So I will use again a linker here. However, she reported a 3-day history. It will 3-day, what? 3-day history of no bowel motion, constipation, I will say it. Constipation for 3 days, 3-day history of constipation when passed hard stool. Okay, coated with red. Following means it followed what? It followed, yeah, it following means that it followed episode of what? It followed following the passage of what? of a fresh, again, or you can just write bright, as it is bright, but you can also write fresh, because we are doctors, we know that. Okay, fine. Fresh blood coated hearts too, full stop. Now I have paraphrased it. On the review visit, Mrs. Howard reported what relieving of pain. Pain persists, but was less relieving of her pain to some extent. However, again, negative finding. However, she reported a 3-day history of constipation. Okay, it was a 3-day history of constipation. Uh, no bowel motion for constipation. No bowel motion for 3 days when passed. Had stool coated with bright red blood. Okay, there was no bowel motion for 3 days. It happened when she last passed this fresh red blood following what this. Now I will be coming to the latest visit, that is the today's visit. Okay, the lady who shared the letter in the group today, there was no today's visit. Now I will say, okay, today Mrs. Howard again presented what? Complaining of what? She's having this pain which is worse after eating. Okay, worsening of what? Worsening of her pain. Worsening of her pain after eating, after a meal. Okay, paraphrase, synonym. After a meal. And what she was it? Moderately distressed, abdominal pain, tense, hemoglobin was this. Okay, then I will just write. Okay, then you can also write. You can also write, now this is the examination. Her examination revealed. You can write her examination revealed moderate distress and tense abdomen, along with quiet vowel sounds, because there were no vowel sound and this was the examination. Or you can also write, okay, fine, uh, moderate, you can also start with like this: moderate distress and tense abdomen along with quiet vowel sound were noted on her examination. Or on examination, moderate distress and tense abdomen along with quiet vowel sound was appreciated. Okay, you can write that also. Okay, and after that we will write, okay, then now we're coming to the labs. Her test results. What her test results revealed. Again, I have used revealed, then I will, use showed. Her test results showed low hemoglobin. Hemoglobin. Hemoglobin, you can, okay, write, okay, 9.3 gram. This also the value if you want. 9.3. And shift to the left. Full stop. And shift to the left. Okay, now if I will just end it, I would say, in view of the above, I would be grateful if you could evaluate and treat Mrs. Howard, um, Mrs. Howard's condition Mrs. Howard's condition as deemed appropriate. Please do not hesitate, or you can just write it next to this also, or you can write in the next line also. Should there be any queries, please do not hesitate to contact me. Okay. Full stop. As you know the doctor, so you will just write it here. Yours sincerely, doctor. Now can you see that how simply I have written the letter? I have not used anything, but what I have done is I have used paraphrasing and I have used synonyms. That's it. I have not used any kind of complex grammar or complex sentences, and I have not twisted the sentences. I have just written the sentences as it, with the flow, void, vowel sound, or partial improvement in her pain. I was taking it as urgent. No, it's not an urgent letter because there is nowhere in this, anywhere in the case notes mentioned urgent. Okay. These are the letters. They are not the official letters from the OET. Whenever it's an official letter from the OET, they will mention the word urgent. Again, just see the see what see the video of urgent assessment of urgent letters, so you can have an idea. Yes, okay. My word count is 268. So how did you know that? I cannot see. Oh, yes, it's 268 words. Yes, my again, you can just you can just cut it down if you want, as just what extra information I have written over here. But again, word count doesn't matter if your letter is written in a very proper structure. The word limit is usually given by OET official is because that you do not write a very short letter, which is just to overcome the word count, and that no one understands, and do not write a very long letter that just you just fill up 2 to 3 papers, just write. So you have, and do not
डॉक्टर
write
है ना
irrelevant. Yes.
ये जो आप लिखना 20th 1st 2007 इसको कैसे काउंट करेंगे लाइक 20th एक वर्ड और फर्स्ट
नहीं
और
नहीं
फिर
नहीं नहीं नहीं
2000
नहीं,
हाँ हाँ
ये पूरा
ये
एक
काउंट
एक
होगा
नहीं, ये
अच्छा
इतना
ये
आई
पूरा
डोंट थिंक
एक
सो, ये
वर्ड है
ये नहीं होगा। और ये जो चीज है ना, ये
अच्छा जी
वाली, ये डॉक्टर जोसेफ का ये सब कुछ, ये जो एड्रेस है, दिस एड्रेस, ये
हाँ हाँ
वर्ड काउंट में
ये
काउंट नहीं है।
एडिड नहीं है
ये वर्ड
अच्छा
काउंट में
जी
काउंट
और
नहीं है।
एक
फ्रॉम
एक और
हियर
बात
एंड दिस, फ्रॉम शुड, यहाँ तक, फ्रॉम
हाँ
फ्रॉम
हाँ
दिस आई एम राइटिंग एंड फ्रॉम डीम अप्रोप्रिएट, दिस इज द
ओके
बॉडी
यहाँ
विच इज
यहाँ
इंक्लूडेड इन
तक
द
है
वर्ड
ओके
काउंट। यस।
ओके और ये हेमोग्लोबिन की जगह हम एच बी लिख सकते हैं
It's better to write the full form, because if it's written there, the full form, then write
हाँ
the full
हाँ
form. Avoid writing,
ऑलराइट
acronyms. Agar, if it's commonly, again, क्या होता है, अगर आपका जो डॉक्टर है, फॉर एग्जाम्पल
हाँ
अगर आप
हाँ
गायनोकोलॉजिस्ट को लिख रही हो, तो आप उसको PCOS भी लिख दोगी, सब कुछ कर दोगी उसके लेटर में।
सही
ओके। लेकिन अगर आप सर्जन को लिख रही हो, तो आप PCOS नहीं लिखोगे, आप उसको
बिल्कुल
पूरा करोगे। इस तरह से अगर आप सर्जन को लिख रही हो और जब लेटर में हीमोग्लोबिन लिखा है, तो इट्स बेटर टू राइट फुल। ये एक ही वर्ड है,
ओके
HB भी लिखोगे तो भी एक ही वर्ड है, और हीमोग्लोबिन भी एक ही वर्ड है।
अच्छा वैसे मैंने ये पूछना था इस लेटर में है कि मतलब 20th को इनिशियली शी प्रेजेंट हुई और आज का जो डेट है वो 22nd है
यस।
इसमें आपने लिखा है शी यस्टरडे आल्सो शी प्रेजेंटेड इसका मतलब है कि मतलब 20th 21st और 22nd मतलब दिस इज 3 दफा वो प्रेजेंट हुई
नो, यस्टरडे मतलब 19th को प्रेजेंट हुई। मेरे पास
आज
जो केस
22nd है
नोट है,
आज का
उसको मैं
आप
नहीं छोड़ी। मैं
22nd को ले।
आप जो कंफ्यूज हो रही हो, आप उसमें 20th वाले में कंफ्यूज हो रही हो।
हाँ
20th वाले में क्या है, इसकी देखो 20th का देखो, रिपोर्टेड यस्टरडे सडन ऑनसेट दिस, कि उसने अपने
ओके
घर में ही इसको इस तरह का सडन ऑनसेट हुआ था, जिसके लिए उसने वेरियम ले ली थी, जिसका पेन रिलीफ हो गया था। आज वो
ओके
मेरे पास आई है, टुडे वो आई है, तो उसने यही सेम उसने मुझे रिपोर्ट किया कि सिमिलर एपिसोड मुझे कल भी हुआ था, विच रिस्पॉन्डेड टू वेलियम।
अच्छा फाइन फाइन
देखिए सब्जेक्टिव मेरे पास वो आज का ये है।
सही सही, बहुत शुक्रिया आपका।
ठीक है
Hello, Dr. Hina. Assalamu alaikum.
जी, वालेकुम सलाम।
Yeah, I'm Dr.